Hi everyone, this is Jenny with Nursing Digipedia. In today's video, we will learn some COVID-19 multiple choice question and answers. These questions may even appear in nursing and other competitive exams. So, let's get started. Before we begin with the question, you shall know what is the full form of COVID-19. So, CO stands for corona, VI stands for virus, and D stands for disease, and 19 represents the year 2019. Question 1. Full form of COVID-19 is A. Coviral disease of 2019, B. Coronavirus disorder of 2019, C. Coronavirus disease of 2019, and D. Coronavirus deficiency syndrome 2019. And the answer is C. COVID-19 is an acronym that stands for Coronavirus Disease of 2019, wherein CO stands for corona, VI stands for virus, and D stands for disease. Question 2. What does the 19 in COVID-19 refer to? A. 19 variants of coronavirus, B. 19 symptoms of coronavirus disease, C. 19th coronavirus pandemic, D. Coronavirus and the disease it causes were identified in 2019. And the answer is D. A new coronavirus, technically named SARS-CoV-2, and the disease it causes were first identified in 2019. Question 3. The virus responsible for COVID-19, A. SARS-CoV, B. SARS-CoV-2, C. SARS-CoV-4, D. None of the above. And the answer is B. Coronavirus is an infectious disease caused by the SARS-CoV-2, also known as severe acute respiratory syndrome coronavirus 2. Question 4. What type of virus is SARS-CoV-2? A. RNA virus, B. DNA virus, C. Both A and B, D. None of the above. And the answer is A. SARS-CoV-2 is an RNA virus. This means that, unlike in humans and other mammals, the genetic material for SARS-CoV-2 is encoded in ribonucleic acid known as RNA. Question 5. From where coronavirus got its name? A. Due to their leaf-like projections, B. Due to their crown-like projections, C. Due to their surface structure of bricks, D. None of the above. And the answer is B. Due to their crown-like projections on the surfaces, coronaviruses got their name. The virus resembles a crown when viewed under an electron microscope. Question 6. Where was the first case of coronavirus found in the year 2019? A. Wuhan, B. Shanghai, C. Beijing, D. Tianjin. And the answer is A. The first human cases of COVID-19, the disease caused by the novel coronavirus causing COVID-19, subsequently named SARS-CoV-2, were first reported by officials in Wuhan City, China in December 2019. Question 7. Corona word derived from A. Greek, B. Latin, C. Chinese, D. Russian. And the answer is B. The name coronavirus is derived from Latin. Corona in Latin means crown. Question 8. What is the meaning of the word corona in coronavirus? A. Moon, B. Beer, C. Sun, D. Crown. And the answer is D. The word corona in coronavirus means crown in Latin. Coronavirus gets its name from the crown-like spikes that it has on its surface. Question 9. Which country had the first recorded case of COVID-19 outside of China? A. Singapore, B. Thailand, C. Taiwan, D. Japan. And the answer is B. As per WHO site news, a case of COVID-19 in Thailand, the first recorded case outside of China. Question 10. Which of the following diseases are related to coronavirus? A. MERS, B. SARS, C. Both A and B, D. neither A nor B. And the answer is C. Coronavirus can cause illnesses ranging from the common cold to more serious diseases such as Middle East Respiratory Syndrome known as MERS-CoV, as well as severe acute respiratory syndrome known as SARS-CoV. Question 11. The genome size of coronaviruses ranges from approximately A. 27 to 32 kilobases, B. 80 to 162 kilobases, C. 26 to 32 kilobases, D. 120 to 180 kilobases. And the answer is C. The genome size of coronaviruses ranges from approximately 26 to 32 kilobases in length, one of the largest among RNA viruses. A genome is the complete set of genetic information in an organism. Question 12. In which age group the COVID-19 spreads? A. COVID-19 occurs in all age groups. B. Coronavirus infection is mild in children. C. Older persons and persons with pre-existing medical conditions are at high risk. D. All the above are correct. And the answer is D. COVID-19 occurs in all age groups. Children can get the coronavirus that causes COVID-19, but the symptoms tend to be milder than adults' symptoms. Persons are at risk who are old and persons suffering from some medical conditions like high blood pressure, cancer, lung disease, diabetics, heart disease, etc. Question 13. Incubation period of coronavirus infection is A. 1 to 7 days, B. 2 to 14 days, C. 3 to 21 days, D. 4 to 28 days. And the answer is B. The incubation period is the time that it takes between when you are exposed to the virus and when symptoms appear. CDC estimates the incubation period for COVID-19 to be between 2 and 14 days. Question 14. The following sample is being collected for corona infection. A. Blood test. B. Urine test. C. Nasopharyngeal swab. D. CSF analysis. And the answer is C. A nasopharyngeal swab, which is a type of nasal swab, is a test used to look for bacteria or viruses that cause respiratory infection, as well as a method for diagnosing COVID-19. Question 15. Which of the following is the standard method for detecting COVID-19 virus from a nasopharyngeal swab? A. Urine albumin to creatinine ratio. B. Patch test. C. Complete blood count test. D. Real-time reverse transcription polymerase chain reaction, also known as RT-PCR test. And the answer is D. Real-time RT-PCR is a nuclear-derived method for detecting the presence of specific genetic material in any pathogen, including a virus. Question 16. The preferred ethanol content in an alcohol-based coronavirus sanitizer is A. 10 to 20%, B. 30 to 50%, C. 40 to 50%, D. 60 to 95%. And the answer is D. The Food and Drug Administration recommends a concentration of 60 to 95% ethanol or isopropanol in alcohol-based hand sanitizers. Question 17. Persons suspected of having had contact with a corona infection must be quarantined for at least A. 5 days, B. 7 days, C. 14 days, and D. 10 days. And the answer is C. The recommended duration of quarantine for COVID-19 based on available information is up to 14 days. Question 18. Which one of these is not a common COVID-19 symptom? A. Blurred vision, B. A cough, C. Unusual fatigue, D. Fever, E. Inability to taste or smell. And the answer is A. Blurred vision is not a common symptom. The others are common things experienced by people who had COVID-19. Question 19. The following are the most common symptoms of corona infection. A. Fever, cough and shortness of breath, loss of taste or smell. B. Fever, rashes and constipation. C. Fever, cough and palpitation. D. Fever, cough and perspiration. And the answer is A. Though there may be other factors, but very common symptoms observed for corona infections are fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell. So, based on the options provided, A is the correct answer. Question 20. Which of the following organ primarily gets affected by COVID-19 disease? A. Kidney, B. Liver, C. Lungs, D. Heart. And the answer is C. Coronavirus spares no major organ in the body. However, COVID-19 being a respiratory disease, it is no wonder that it primarily affects the lungs. Question 21. Dash are the natural reservoirs of SARS-like coronaviruses? A. Pigs, B. Monkeys, C. Bats, D. Dogs. And the answer is C. As per researchers, bats are natural reservoirs of SARS-like coronaviruses. Question 22. When is it safe to be closer than 6 feet to another person who is not sick with COVID-19? A. When the person is related to you. B. When you have already had COVID-19. C. When the person normally lives with you. D. When you are outdoors. And the answer is C. When a person lives with you and has not had any contact with infected person, it is obvious that you are safer than in any other condition. Question 23. As a clinical nurse working in COVID-19 ward, one should wear A. Gloves and 95 mask, B. N95 mask all the time, C. N95 mask, face shield and gloves, D. Appropriate PPE as per the working condition. And the answer is D. Option A, B and C are all PPE sets. When working in COVID-19 ward, one should always wear appropriate PPE based on the working conditions. Question 24. Following practices are useful to prevent corona infection except A. Hand washing, B. Taking OTC medicine, C. Social distancing, D. Cough etiquette. And the answer is B. Hand hygiene, physical distancing, mask, and the cough etiquettes are examples of corona prevention and control measures. Question 25. Staying apart from other people when you have been exposed to the coronavirus is called A. Physical distancing, B. Isolation, C. Quarantine, D. None of the above. And the answer is C. Quarantine separates and restricts the movement of people who have been exposed to a contagious disease in order to determine whether they become ill. Question 26. The official names of COVID-19 and SARS-CoV-2 were issued by the World Health Organization on A. 11th February 2020, B. 11th March 2020, C. 14th October 2020, D. 25th December 2020. And the answer is A. WHO announced COVID-19 as the name of this new disease on 11th February 2020. Question 27. The World Health Organization declared COVID-19 a pandemic on A. January 11, 2020, B. March 11, 2020, March 11, 2019, D. December 11, 2019. And the answer is B. The World Health Organization on March 11, 2020 has declared the novel coronavirus outbreak a global pandemic. I hope you found this session useful. I'll see you soon with another tutorial video. Till then, stay safe and stay healthy.